Assalamu alaikum. As you have already understood the gross features of the pons, now I will tell you about the internal structure of the pons. As you already know that the pons have the ventral portion as well as the dorsal portion. In the ventral portion, you can appreciate its cranial nerve nuclei. The most laterally, and you can see the trigeminal nerve and its two roots, the sensory root which is laterally and the motor root which is medially. You can see that the sensory root, which is the laterally placed root, this is larger as it has the sensory supply, so that is why its sensory root is bigger, and the motor root or trigeminal nerve is located medially. Other three cranial nerves are the from medial to lateral are the seventh, which is the facial, eighth, which is the vestibulocochlear, and also the abducent nerve. So there are 6, 7, 8, and the fifth cranial nerves are included in the pons, which are mainly the 6th, 7th and 8th will comes in the caudal portion of the pons. This was the ventral section of the pons. This is the dorsal portion of the pons, where you can see the facial colliculus, which is the bulge which is formed due to the winding around of the nuclei. So now we will study the sections of the pons under two headings. Firstly, we will discuss the caudal section of the pons. In the caudal section of the pons, firstly you can see the cavity of the fourth ventricle. Then we can divide it into the grey matter and the white matter. The grey matter include, as you know, nuclei which will be of 5th, 6th, 7th and the 8th nerve nuclei. If we come on the lateral side, you can appreciate the spinal tract and the nucleus of the trigeminal nerve. Then you can appreciate the vestibular nuclei and the cochlear nuclei. So this will cover the 8th nerve. Then comes medially, you will see the motor nucleus of the facial nerve and the nucleus of the abducent nerve. Now a very important point is the facial colliculus, how it is formed. You can see in the center the nucleus of the abducent nerve. The motor nucleus of the facial nerve wind around the nucleus of the abducent nerve, forming a prominence or swelling, forming the facial colliculus. So there will be the bulge overlying this colliculus. So in the grey matter we discussed the 5th, 6th, 7th and the 8th cranial nerves. Then comes the also you cannot appreciate here, but there are present superior salivatory nucleus, lacrimatory nucleus. Then we comes to the white matter. In case of the white matter, you can appreciate in the center the trapezoid body, which is formed from the fibers arising from the cochlear nuclei. Then laterally you can see the medial lemniscus, the green body. This medial lemniscus, as I told you earlier, this is the sensory decussation at the level of the medulla oblongata. So when we comes to the basilar part, this basilar part is same in the caudal section as well as the rostral section of the pons. This basilar portion have fibers and nuclei. You can appreciate here the pontine nuclei which is located in the basilar portion, and from these pontine nuclei The fibers arises as pontocerebellar fibers, and these fibers go transversely to reach the middle cerebellar peduncle. There are also some fibers known as corticospinal and corticonuclear fibers. So, these fibers are the same in the caudal as well as the rostral section of the pons. This was all about the caudal section, but in this caudal section you will one thing is left, the medial longitudinal fasciculus in the midline. You can also see this. Then we comes to the rostral portion or the upper portion of the pons. Here you can appreciate the cavity of the fourth ventricle. Again we will discuss under gray matter and the white matter. In case of the white matter, again there are the fibers, as I told you, corticospinal, corticonuclear fibers. Also the pontine nuclei, from there the fibers arises as pontocerebellar fibers. They will reach the middle cerebellar peduncle. And you will also have the medial longitudinal fasciculus, trapezoid body, medial lemniscus. As well, you will also find here the spinal lemniscus. Why you have here the spinal lemniscus? Because there was, as I told you earlier, this is the continuation of the spinothalamic tract when we were discussing the ascending tracts. So you will also find the spinal lemniscus here. In case of the gray matter, you will just find the fifth cranial nerve nuclei. Again, lateral will be the main sensory nucleus of trigeminal nerve, and the medially there will be the motor nucleus of the trigeminal nerve. Other thing, medial longitudinal fasciculus is present. So the main differences, if we compare the caudal and the rostral portion of the pons, then we can see that the basilar portion is the same in both sections. The main difference comes in the nuclei. All the fourth cranial nerve nuclei, 5th, 6th, 7th and the 8th cranial nerve nuclei were present in the caudal section of the pons, while the just 5th cranial nerve nuclei were present in the rostral portion of the pons. I hope now it's easy for you. Then we comes to the lesions of the pons. First one is the astrocytoma. This is a tumor, mainly the pediatric tumor, and its signs and symptoms manifest as the ipsilateral cranial nerve palsies and contralateral hemiparesis. Its signs and symptoms will include the facial muscle weakness, ipsilateral or bilateral lateral rectus muscle. As you know that the 6th cranial nerve supplied the lateral rectus muscle. That is why when there will be the tumor, there will be compression on these cranial nerve nuclei and resulting in the muscles innervated. So we will have the lateral rectus muscle weakness, nystagmus, jaw muscle weakness, hearing impairment due to the vestibulocochlear nerve impairment, then contralateral hemiparesis, quadriparesis because corticospinal fibers, as I told you, in the basilar portion, then light touch anesthesia over the face, contralateral sensory defect over the body and cerebellar signs. Next one is the pontine hemorrhage. Pontine hemorrhage can be unilateral and it results in the ipsilateral facial paralysis and contralateral limb paralysis. There may be a conjugate ocular deviation. In some hemorrhage, the pupils may be pinpointed and there is bilateral facial and body paralysis. Then is the pontine infarction. It is also known as a foveal syndrome. It occurs when there is an occlusion of the paramedian branches of the basilar artery, resulting in the ipsilateral abducens nerve palsy and contralateral hemiparesis. It also contains variable contralateral sensory loss. If this lesion extends laterally to the roots of the facial nerves, then there will be the ipsilateral facial paralysis in addition to the previous signs. Syndrome of the mid-pontine base occurs when there is occlusion in the paramedian branches. Its signs and symptoms include the contralateral hemiparesis, ipsilateral loss of pain and thermal sense, and paralysis of the masticatory muscles, and also ataxia. I hope this is understood now. Allah Hafiz.